At nagbabalik mga kasambahay ang Doctors on TV. Our topic for this morning, Attention Deficit Hyperactivity Disorder o ADHD. Panoorin muna natin ang video na ito.
Ang ikatlong linggo ng Oktubre ay idineklara bilang National Attention Deficit Hyperactivity Disorder o ADHD Awareness Week ayon sa Presidential Proclamation No. 472. Layunin ng nasabing selebrasyon na mas mapalawig pa ang kaalaman ng publiko kaugnay ng nasabing kondisyon. Ang ADHD ay isang seryoso at karaniwang brain disorder na nakaaapekto sa 3 hanggang 4% ng populasyon ng bansa. Sa datos ng National Council for Disabilities and Chronic Brain Disorder na ito ay isa sa mga dahilan ng social, academic, and emotional impairment. Subalit ayon sa mga eksperto, malaki ang chance na maging normal ang buhay ng isang batang may ADHD kung ito ay madedetect ng maaga at malalapatan ng tamang interventions. Kaya ngayong umaga, ating alamin sa eksperto ang mga unang palatandaan ng Attention Deficit Hyperactivity Disorder o ADHD.
At yan po mga kasambahay, ang topic natin for this morning, ADHD. Medyo malalim ang topic natin, no? So of course, we need an expert to help explain the topic and what we can do about it. We've invited a Developmental-Behavioral Pediatrician. She's a past president for the Philippine Society for Developmental and Behavioral Pediatrics, Vice President for Medicine, Philippine Association for the Gifted. She's currently the Treasurer of the Philippine Pediatric Society, a faculty member at the UERM College of Medicine, my teacher, Dr. Joselyn Alonzo-Eusebio. Good morning, Dr.
Good morning, and thank you for having me.
Good morning. It's our pleasure.
Oo, Doktora.
Grabe, pagpasok pa lang ni Doc JM kanina. Ma'am!
Nagulat ako, yung teacher ko. Pili ko ng estudyante na naman ako sa College of Medicine sa UERM.
Ay, parang tuwang-tuwa ka eh.
Oo, syempre
Thank
excited.
you.
Tuwang-tuwa ka eh. Parang it was fun having Doktora as your teacher.
Of course.
Thank you.
Hindi naman traumatic. Hindi naman ako.
I don't see any sense. And besides the personality ni Doktora, it's not gonna be traumatic at all.
So, Doktora, ADHD ang topic natin this morning. Ano nga bang ADHD?
Oo.
At bakit nagkakaroon ng ganyan?
Oo, ang ADHD is Attention Deficit Hyperactivity Disorder. It is a developmental-behavioral disorder na kung saan yung bata may senyales ng hyperactivity, impulsivity, and inattention.
How will you know, Doktora, kung abnormal na ba ang activity na to?
Kasi
mga
diba
bata,
normal lang na ang
normal
bata
na
ay malikot. Especially during ages 2 to 4 years of age. No? But it becomes a problem kung ito ay nagkakaroon na ng disruption in academic
Alright.
at saka social functioning. So much so that in school, yung bata sobrang parang supervisor, di ba?
They call that kiti-kiti.
Makulit, kiti-kite, always on the go, cannot sit still.
Supervisor.
Acting like a
pala.
supervisor inside the classroom na nadi-disrupt yung klase. Oo. Tapos hindi na niya nagagawa yung normal na dapat na-accomplish niya sa school. Hindi siya nagsusulat. Hindi niya tinatapos yung pag-copy ng assignment. Hindi siya nagli-listen sa teacher. Maingay siya. Talkative. Oo. Tapos sometimes nakakasakit siya ng kaklase.
Typical ba sa mga bullying ito, Doktora? Yung mabilis, madalas ng
Actually, maraming ADHD na nambubuli.
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 Okay.
Nambubuli.
So these are the warning signs na talagang baka kailangan ipa-check up
Oo.
na.
Usually, it is the teacher who will complain. Kasi malimit sa bahay, maaring dinidismiss lang ng parents na, ay kasi lalaki siya. Kasi mas madalas ito sa boys. Ang ratio is 4 boys is to 1 a girl. Pero meron din sa female. But the symptom in females or girls is more of lack of attention and concentration.
So even before the preschool age, before pa sila pumasok
Ay, may
sa school,
senyales na.
may identify natin.
Actually, nasa sinapupunan pa lang. Ang sabi ng mother,
Hyperactivity
naku,
na.
doktora, sakit-sakit panay ang kanyang sipa. Di ba?
Okay.
Tapos paglabas naman, ay, naku, ang hirap patulugin sa gabi.
Okay. So
At
that's
pag
one na.
siya ay naglakad, hindi na po yan naglakad, tumakbo na po. Di ba? So, yun yung mga early signs.
Okay.
Wow! So dapat yung mga parents pala mapagmasid.
May red flags na
Pag hirap
talaga.
na hirap ka, bantayan mo na yung bata. Doktora, is there a way na kung alam mo na, oops, parang grabe yung pain ko sa batang to kailangan mag-consult na ako sa aking
Hindi naman.
pediatrician.
Kasi magiging problema lang naman talaga pag lumabas na at pumasok na sa school. Oo. Paglabas, meron ng early signs. Yun nga, sinabi ko, sobrang likot. Sa church, sa mall, sa bahay, hindi mo talaga
Mapatigil.
siya mapaupo.
Parang-
At pag nakaupo, kamay, paa.
Malikot talaga.
Kiti-kiti pa rin.
Kiti-kiti.
So how early, Doc, usually can parents detect or...
Ang sabi ko nga, during the preschool age, meron
Preschool
na.
na.
Kaya lang, what will confirm it is that when the child goes to school, and the teacher will really call the attention of the parents. So pag ganun, huwag na tayong mag-deny, di ba?
Napag-guidance counselor.
Maya na sa guidance counselor. Tama.
But or is it a problem with upbringing? Kasi naman ba ng parents? Or is there really something wrong with the
Yeah, this is
child?
inborn.
Inborn?
And
Okay.
it is strongly genetic. In fact, it is considered to be a family affair. Meaning that if you as a parent have that condition, you will pass it on in about 50% of your children.
Wow.
Okay. So you can't blame the parents? Kasi baka may sabihin ng
Kaya
teacher,
nga, ang
itong mga magulang
sinasabi
kasi
namin
ito.
sa
pinababayaan.
parents,
Oo.
talagang yan na ipamana most of the time. But there are conditions that will increase the risk. Like for instance, premature yung baby. Yung tinatawag natin high-risk pregnancy or even delivery or even at birth. Prematurity is one of the risk factors.
Sige.
So, just to clear terms up, kasi some people confuse it also with autism.
Yes.
Ano naman po yung autism?
Malayo yon. Pero the two can coexist now. Before kasi, pag sinabing autistic ka, hindi ka pwedeng may ADHD.
ADHD.
But now, in the new criteria, DSM-5 criteria, the two can coexist. That's why, meron na tayong justification na kahit autistic ka, na dati-rat, hindi ka pwedeng bigyan ng gamot for ADHD, pwede ka nang bigyan ng gamot.
Okay.
Just to decrease the hyperactivity, inattention, impulsivity symptoms.
Kawawa naman yung bata, no?
Yeah.
Nadalawa yung kanyang
Oo,
condition.
pero the two are different talaga.
Yes.
Ang autistic, alam naman natin,
Yeah.
fleeting eye contact, selective response, language delay, repetitive stereotypic behaviors.
Alam mo, yung school ng anak ko, ako kasi may 5 years old Kaya talagang I have to be attentive.
Yeah.
Sa school ng anak ko, sa C-Tech before siya nag-Xavier, magaling ang teacher.
Oo.
Yung teacher, nung 4 years old sila, lahat ng bata na papasok, pag nag-good morning ka, pinapatitig ka sa mata.
Okay.
Eye contact. Because
Pinapa-eye
that is
contact ka.
actually one of the early signs in autism. Minimal or fleeting eye contact.
So kung merong hindi nag-eye contact sa kanya, tinatawag niya yung parents.
Tama naman.
No.
So dapat yung mga teachers talaga
So,
trained
yes,
to
actually
identify
teachers,
these
they are.
students.
They are.
Yes.
They have to be. Okay. So anyway, bago po natin ipagpatuloy ang ating usapan ngayong umaga, healthy tips naman ang ituturo sa atin ni Miss Yas Muralla dito lamang sa Natural